avoided treating your bad veins because you think the procedure would be too painful or the recovery time too long? Well, don't let assumptions keep you from alleviating your leg pain. Joining us with the truth about troublesome veins, please welcome Dr. Carlos Hamilton with Hamilton Vein Center, along with his patient, Gail Poth. Hi there.
Hi.
This is the time of year where people might have some time off and they start thinking, maybe I need to use this time to get certain procedures done. Some procedures do take long recoveries, but with vein, the way that you do them, not today.
That's exactly right. People can come in, get treated, get right back to their normal routine.
Get back
it's really
to the party,
great.
Is what
Absolutely.
I say.
It's a busy time of year.
All right. We were talking about vein issues. A lot of people don't realize they're vein issues because the symptoms seem like they might be muscular or something else.
Right. There are all kinds of things like that. Exactly. Just treating the veins. There's so much more than just bulging veins. People's skin turns brownish around the ankles. They can get ulcers. Their feet will turn kind of a purplish color sometimes. Legs can feel tired, heavy, achy, sore. All these things that people don't relate to the veins.
Yeah. And if we look at something like when the skin turns a different color or gets scaly, we're thinking it's a dermatology issue, not a vein issue. You had all those symptoms, but the other thing that just really stopped you in your tracks, no pun intended, they hurt and it was hard to walk.
Yes, I had like lead feet because lifting your legs with the pain that was in my legs, it hurt so bad. And I had it for so long and didn't realize there was a fix. I mean, I'd had it
Did you realize what the problem was? Did you know it was veins?
No.
What did you think it was?
I had no idea. I mean, it was, okay, you have bad knees, you have a bad, no, okay. Why do you have such a hard time walking? I mean, I would trip and fall because of picking up my feet hurt. I mean, it just, and now I don't.
Yeah, and you have like grandchildren stuff to keep up with. You didn't have time for all this nonsense, right?
No. And I'm retired, so I want to be able to enjoy time off. So
as luck would have it, your husband heard something on a TV show one day. What show was that?
Deborah's. I think it was yours.
Yeah. And so you were listening to the patient on the show, which is the patient you brought on, and you thought, that's me.
Look at my feet, look at her legs, and she talked about it and went, oh my gosh, that's what's wrong with me. And it's on TV. And I can have it fixed. And I did, and he did. And it's, you just do not realize that unless you have the pain in your legs, the hurt, it's there. And it's not anymore because he did his, and it's done.
We'll talk about what this is in a second. But Dr. Hamilton, literally what happens if people don't know what's wrong and they just kind of succumb to the pain, they stop walking. And then it's a downhill battle after that.
You know, so many times people are trying to find answers for why their legs are heavy, why they're sore, you know, what's going on. I can't walk the way I want to. They go and see doctor after doctor, and they just never get a satisfactory answer for it.
Those ulcers are never healing.
That's exactly right. And so, you know, these pictures really tell the story, and this is what happens to vein disease if it goes on a long time. And you'll notice on a lot of these, there are not bulging veins on people. And that's what makes it hard for a lot of people to really understand, is that...
Well, even some doctors miss it in giving them the right diagnosis.
Oh, absolutely.
So let's go through some of those myths of vein disease. One, I think we just kind of said it's just a cosmetic issue. Myth.
Right, absolutely. This is much more than a cosmetic issue. Sure, some spider veins are a cosmetic issue, but, you know, ulcers and sores and rashes. People get these rashes around the ankle and lower leg. They just never respond to steroid creams and all this, and it's directly from the veins.
The other myth is vein treatment is painful. I think Gail just said he just did this and that was that. It used to be even that whole, when you say vein stripping, I mean, it was crazy back then.
You know, now people are right back at work the same day. They come to our office, go back and get treated.
Yeah, and the way that you do it is how?
We just put a very small tube into the vein, put some numbing medicine around the vein, it heats up, closes the vein, and that's really it.
Yeah. The other myth is that, you know, it's a lengthy recovery. We just said you're right back at the party in a matter of, minutes.
Exactly.
And also, vein stripping is the only way. Do we even really do vein stripping anymore?
There are people that do vein stripping, and it's really a procedure that's time has come and gone, to tell you the truth.
Keep up with modern technology.
Absolutely.
Yeah, so not every office does it, and that's the importance of going to someone who does what you do. Treatment is expensive and not covered by insurance is the other thing people think. They think it's just a cosmetic issue.
Absolutely. You know, people are like, you know, it's a vein deal, it's cosmetic, I don't, you know, I can't afford it. Insurance pays for this, Medicare pays for this. All of the payers realize this is a real medical condition, and untreated, it has serious health effects.
Yeah, and of course, you can literally get your life back as you have.
Yes. And it's such a joy to be able to go, I don't hurt. I don't have the pain that I had since October, because this is when we did, after that show, it was like, okay, can I get an appointment? Yes, you can. And I was there, and it was done, and here I am. It's like I'm on the show because it works. I mean, really, you just don't realize unless you're hurting that it's curable. It's not a shot in the dark. It's a for real thing.
Yeah, yeah. All right. So whether you have all of those symptoms that we talked about, or the ones, I would imagine a lot of people who miss it are the ones who don't have those visual cues. But if your legs are just, I think you said like you felt like you were walking in mud boots.
Yes.
If your legs just feel different or tired, if you have restless leg syndrome.
Absolutely. Leg cramps at night especially are common with vein problems.
Like we say leg cramps at night, so is it every now and then, or if it's something that's happening more than...
Those Charlie horses, you would get them all the time. I have not had one since I've had the procedure. Wow. I mean, it was like a every night thing with the Charlie horses, and then no more.
All right. We got so many people, they can't sleep through the night. And haven't for years.
Okay, well, if that sounds like you can go in for a free consultation to any one of the 4 Houston area locations for the Hamilton Vein Center. For more information, you can call 281-565-0033, 281-565-0033, or visit their website at hamiltonvein.com. They have locations in Sugar Land, Kingwood, Lake Jackson, and Bel Air. Thank you so much.
Thank you.
Because you just got a great Christmas gift, didn't you?
Yes, I did.
Yeah. All right.
Besides being here, yes.
Yeah. Well, great gift ideas that make even better stocking stuffers.